This is Julie Edgar of Gemini Social Enterprises. Today I'm interviewing Dr. Dean Ziegler of Ziegler Chiropractic Clinic. Dr. Ziegler, what can you tell us about your career and qualifications treating whiplash patients in the Lehigh Valley?
Okay, I started in 1996. I was working for my brother here. We were seeing personal injury, Lehigh Valley whiplash patients. I bought him out in 2001. I'm certified in chiropractic, spinal trauma, and whiplash, which is taught by Dr. Dan Murphy, a renowned lecturer in the field of whiplash. I also have a 3-year certification in the American Chiropractic Rehabilitation Board to strengthen and condition patients once we get them out of the initial phase of the acute injuries from whiplash.
Great. So Dr. Ziegler, what's the edge you bring to your practice that benefits your patients the most? What sets you apart from other Lehigh Valley practitioners?
Well, I would say the navigating the insurance process. There's certain pitfalls and so on, and if you don't have the experience, I always tell my patients, we're gladiators in the personal injury arena.
I see.
For people not familiar with this arena, it's very easy to get sidetracked and what have you by the insurance companies. So over 15 years experience of treating Lehigh Valley whiplash patients.
So you know what pitfalls to avoid.
Yes.
Very good. Well, tell me a story, Dr. Ziegler, about an excellent result that you have provided for a Lehigh Valley whiplash patient.
This is a funny story. I treated a patient quite some time ago that I did help her with her whiplash, so she recovered fully, or as best as she could. We went to trial, and it's just one of those things where she was the perfect witness. She had a 20-year experience that was waylaid by her injury at the attendance at her employment. She couldn't see her ailing mother in upstate New York because the whiplash prevented her from driving and so on. I represented the testimony of 3 other doctors, as well as going over that she was not functioning as she could before. We had the highest soft tissue injury award in the Lehigh Valley at that time.
Remarkable. So, Dr. Ziegler, if a person suspects that they have a whiplash injury, what is your best advice for steps that they absolutely must take to protect themselves and to recover as well as possible?
Most important thing is obviously to get treatment, but whiplash is a very acute injury, but has long-term effects. The best thing is to get treatment as soon as possible. Whether you go to an emergency room or what have you, you need to get the x-rays, rule out any type of cervical fracture, which could be life-threatening. Most people, if they're in an ambulance, they go to the ER and so on. After that, you have to address the misalignment from the whiplash and the soft tissue injuries. You could see a chiropractor such as myself or others specializing in whiplash. That basically would be the most important thing. Sometimes there is a settlement offer out of nowhere that they want you to prematurely stop treating. And I like to say, as I said to my patient today who was in a car accident, if you have a limp or what have you and you think it's going to go away, that's fine. But when you settle and that limp is still there and it doesn't go away, that's a permanent disability or what have you. So the most important part is to get treatment as soon as possible, get diagnostic testing to rule out any type of pathology related to whiplash, and then make sure that you recover fully before you sign any papers with anyone.
Tremendous. Thank you very much, Dr. Ziegler, for sharing your expertise with us today.
Thank you.